I think the biggest questions that we have been receiving so far into our newsroom over the last couple of days, and I'll start with, how the decision was made to transition into this new designation and what that kind of means for the folks that you serve in the Boulder City community.
Well, the decision was made on financial basis. When the HR1 bill was passed last year, it cuts a program called provider fee. It's a provider fee program, provides enhanced reimbursement to private hospitals in Nevada. It's part of the Medicaid program. When HR1 was passed, it cut the provider fee reimbursement to our hospital by about 50%, which is going to be in effect after 2027. So we'll start seeing it chip away. The full 50% effect is going to be a couple of years after that. But that provided a measurable outcome and a measurable forecast to our cash situation. Boulder City Hospital is the only hospital, critical access hospital in Nevada that's not part of a corporation or recipient of regulated subsidies through a tax district or mining proceeds. So we live or sink or swim on the strength of our operation, but being a rural hospital in a small market, we're kind of living on very, very thin margins. So when that happened, among other things, we started looking at what do we do in order to ensure the long-term viability of essential medical services for this community in the long term. And we researched, and this provider type called rural emergency hospital became effective in 2023. I think there's only 44 or 45 hospitals nationwide that have used this provider type. We're the first ones in Nevada to exercise this option for us.
So moving on to the rural emergency designation, what is it currently?
Okay, so currently we're designated as a critical access hospital, and that's reserved for small rural hospitals of 25 beds or less. There are some caveats to that. You can have some specialty beds available. You can have a long-term care or skilled nursing unit available as well, but your medical surgical beds are restricted to 25 beds, and you get cost-based reimbursement from Medicare. Otherwise, we're a full-service hospital. We provide all services, inpatient, skilled nursing, all kinds of outpatient services, including a primary care clinic and surgery, 24/7 emergency room. What the rural emergency hospital designation does is it prohibits you from doing acute inpatient care. So our medical surgical acute unit will be eliminated, and our acute psychiatric unit for geriatrics will be eliminated. The length of stay for observation patients cannot exceed 24 hours. We'll still do skilled nursing level of care on our skilled nursing unit, but that's post-acute care. That's not acute care.
We put that in layman's terms for folks. When you say skilled nursing for post-acute, that is for if someone has already been treated or is in the process of being treated?
Yeah, great question. Somebody who's been in an acute care hospital, let's say for a joint replacement or some other kind of major surgery, as they're recovering, at some point they reach a point where they stop qualifying for acute care services, and the insurance companies usually say, okay, now it's time to transition you down to a lower level of care. Skilled nursing is usually that lower level of care that people go to afterwards. For us, we take care of those patients and provide rehab for them. So a lot of folks either who are recovering from an acute care stay at another hospital will come to our hospital for post-acute care for rehab or other kind of medical intervention.
So things like physical therapy would likely be affected then as well.
That's predominantly what we do in a post-acute care here at Boulder City Hospital.
How do we expect this to impact community care as a whole? I know that there are quite a few services that will remain, that emergency care and things like that. But I think the concern in the community is really just, are we still going to have what we need so we don't have to keep coming into the valley to get care?
Right. The essential services of emergency, 24-hour emergency and outpatient services, radiology lab, physical therapy, and primary care, all those things are going to remain, as well as our skilled nursing services. The thing that's going away is, like I said, acute care. So if somebody comes to the ER and they need to be admitted for acute care services, they're going to have to be transferred to another hospital in metropolitan Clark County. Same thing if somebody is in a behavioral health crisis and need to be admitted to an acute psychiatric unit, they will no longer be able to come to Boulder City Hospital. They'll be transferred to another facility somewhere in Clark County.
Got it. And then I think my last question is I was reading about the 24-hour care and how that will no longer kind of be a thing. Can you just talk more to that cutoff and when they would need to be either transferred to another hospital or kind of sent home at that point?
Right, right. So under the rural emergency hospital provider type, we are able to provide observation care. So if somebody comes into the ER, they need to be looked at and observed for a while longer, maybe put on telemetry to check, make sure their heart rhythms are okay. We can still do that, but the average length of stay for that service cannot exceed 24 hours. Which doesn't mean that you got to get kicked out in 24 hours. It means the aggregate length of stay for all of our observation care throughout the course of the year has to average less than 24 hours.
Okay, so they could be there for, let's say, 8 hours, take a couple hours, 8 hours, take a couple hours.
Yeah, yeah, they
Okay,
could. So we just have to manage it ourselves to make sure that in aggregate, the 24-hour length of stay is not violated.
got it. Um, Tom, I think that's all the questions that I have for you. Do you have anything else that you wanted to touch on that we might have missed or didn't clarify well enough for you?
I think you covered it all.
Okay. Thank you again so much. I really appreciate your time. I know you got a lot on your plate.
My pleasure. Thank you very much.